mention a couple of things. One, we are just raising concepts, so I think this would be just a conversation on raising concepts. We are not going to be conversing about the merits of the bill, so we'll try to keep it simple. There will be plenty of opportunity to have those conversations going forward. I wanted to thank our administrator, Beverly Henry, for her work and keeping things together in a very, very busy time, and also our members of the OL Office of Legislative Research, Office of Fiscal Analysis, and the LCOs for their hard work and a lot of effort that they put in through this time in the committee in a very short period. So we are blessed to be working with you, and thank you, Mr. Chair.
Thank you, and thank you for the sentiments. For those of you who may not be aware, for the time being, Senator Anwar will be serving as Senate Chair of the Public Health Committee. Senator Wong.
Thank you, Mr. Chair. And indeed, it is a short session, and we are raising concepts, although, as you will see, some of these concepts will be controversial. But again, I want to reiterate, in us supporting raising the concept does not necessitate that any of my colleagues support the concept. And we'll make that determination later, but I wanted to preface that. And I want to extend my very, very best to Chair Mary Doherty Abrams in her health and recovery as well. Thank you, Mr. Chair.
Thank you, Senator. We never do anything controversial in the Public Health Committee. Senator Summers.
Yes, good morning. I'm hoping you can hear me. I'm reaching you from my car. I'm on the way to the Capitol this morning. I just wanted to reiterate what Senator Wong had said, which is we do have quite a few concepts on this agenda today. We have a very short session. I'm hoping that the Public Health Committee will really prioritize the concepts that we can do a thorough job on to get across the finish line, rather than raising too many concepts and inundating people with public hearings where we cannot, in the end, get these bills across the finish line. There are some items that are controversial on this. I think that our ranking member from the House may ask that certain ones are pulled out so we can vote on them individually. Again, I reiterate what others had said. These are concepts. If we vote for them, that does not mean that we will continue to support them going through the process. And we vote against them, it also does not mean that we won't support them at some point in time. I'm looking forward to working with everybody on the Public Health Committee once again. And I look forward to a non-controversial session and trying to work together to really focus on the things that we know are so important to the people of the state of Connecticut. Thank you.
Thank you, Senator. Thank you for those sentiments. I think we all agree that we're starting off with a pretty broad top of the funnel, but it will narrow very quickly. I think that you will see with most of these concepts, our intent is at least to shine a light on them and to get a public hearing, whether or not they necessarily make it all the way through the process. Representative Pettit, good morning.
Thank you, Mr. Chairman. I guess my concern is that I feel like we've already been flooded. I had hoped that and I was speaking to the broad legislature, not just the Public Health Committee, I had hoped that people would focus on COVID-related public health issues, children's health, the economy, and jobs. But people, even with a short session, seem to have inundated us and many other committees with multiple bills. So I think we need to try to take the bull by the horns and focus on the bills that will have the biggest impact upon the impact that has occurred to us as a state over the past 2 years due to COVID. So thank you.
Thank you, Representative. I'm sure we all agree that it seems like a lot. It's an interesting point that we should only do pandemic-related things, because one could argue that we postponed doing a lot of other non-pandemic things now for a couple of years because of the pandemic. And how long can we keep from doing the people's business? And so that's a kind of argument. But rather than getting to that argument, which we certainly can at some point, we have a number of concepts to be raised. I'd like to read through them quickly. My understanding is there are at least a couple in which we cannot vote for them in sort of a larger en masse vote. But well, actually, why don't we open it up for that right now? Are there specific bills that anybody would object to amalgamating, so to speak. Probably just best to get that on the table.
I've gotten comments from members, Mr. Chairman, that they would like to have the assisted suicide and bill concerning reproductive, the title changed. It went from something involving abortion to something involving reproductive rights on the second go around.
So those are two that have been noted and will be separated in the others.
Mr. Chair, I have also received some requests to separate out, I believe it's item 18, which has to do with the gun violence preventionist and a declaration that gun violence is a public health crisis. People are not in accordance or not on board with the title of that bill, and they would like that also separated out, please.
All right, so that's three. Are there others? If not, we will do each of those three separately. Why don't we begin by amalgamating the rest, and I will quickly go through the list just so we're clear. Number one would be an act requiring nursing home and long-term care facility residents to undergo criminal history and child abuse and neglect registry record check. Apparently that should actually be sexual offender registry record check, which we will correct as the concept is further developed. Next, number two is an act concerning the Department of Corrections healthcare delivery system. I think we're all very much aware of the concerns we have with the correction system and their healthcare situation, which was only exacerbated by the pandemic. We'll skip three for now. Number four, an act concerning children's mental health. This is a large bill of many sections that has been worked on collaboratively across a number of committees, notably children's. It will be a significant bill that we will go into with some great detail and will probably be an extensive public hearing. Five, an act concerning Valley and Whiting forensic hospitals. As everybody is aware, the Whiting Forensic Task Force has completed its work and has made a number of recommendations for the Public Health Committee to consider. Six, an act concerning rare diseases. We're also aware there's a Rare Diseases Council that has come forward with recommendations, including the creation of a permanent commission. Number seven, an act concerning the use of electronic nicotine delivery systems and vapor products by minors. This is, in a sense, a follow-up on our Tobacco 21 legislation, where we might consider flavored vapes online issues as well. Number eight is an act concerning suicide prevention. We have noticed the uptick in unfortunate suicides during the pandemic, but this is a problem we've been working on for many years, and there are a number of good ideas that we would like to consider this session. Number nine, an act concerning opioids. Similarly, we do things every year, but we really still need to find ways to reduce opioid deaths and tragic outcomes. John Michael Parker, Representative Parker, and others have been involved with a number of working groups, and we have a number of ideas to discuss there. Number 10, an act concerning surgical smoke. This is a bill we've seen before, where there seems to be serious concern in surgical settings about healthcare surgical practitioners inhaling surgical smoke. We hope to get to the bottom of it this year. Should be a pretty simple, straightforward bill. 11, an act concerning menstrual products, primarily to assure that menstrual products are available in a variety of settings such that they are readily available. 12, an act concerning home sharps return. This is a bill that would help us assure that sharps are properly disposed of in a variety of settings beyond what we have today. 13, an act concerning testing for the human immunodeficiency virus. This is an effort to see if we would choose to add this particular test to the list of tests that we currently require. 14, an act concerning endometriosis. This is a bill to deal with what is a clear and present problem for some women that we hope that we have the solution for this year. We're going to skip 15. 16, an act concerning various revisions to the public health statutes. This is the Public Health Committee's technical bill, if you will, this year. 17, an act permitting pharmacists to administer influenza vaccinations to children over the age of 12. This is something we've considered in the past. It seems more pertinent now after a few years of the pandemic, with a number of different practitioners providing the ability to administer vaccines. We want to explore whether this is the time for pharmacists to administer the flu vaccine. Okay, those are those. Do we have a motion to vote in vote concepts? Let me just be clear on 1, 2, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, and 17. Do I have a motion?
Yes, so move.
Moved by Senator Onward. Do I have a second?
Second.
Seconded by Representative Bill Chris.
Second.
All right, and that's a third by Senator Christian. Do we have any further comments before we bring this to a vote? Use your raise your hand function. There's Representative Miko, followed by Representative Pettit.
Thank you. Thanks, Mr. Chair. I just have, I'm questioning why we are doing this in this fashion. In other words, it traditionally, my recollection is that traditionally it's the prerogative of the chairs and the screening group, which includes the ranking members, to present bills to us, to concepts to us to be raised and drafted as bills. You have done a good job with that. And I don't understand why we're separating out. So maybe you could clarify for me.
My understanding, and perhaps Representative Pettit and Representative Summers will elaborate, is that more legislators wish to have comment with regard to those three bills, so that it might actually expedite the approval of these concepts if we were to leave those three out, so we could have separate comments. I take your point. Maybe we're just bending over backwards at the end of session to make sure everybody is heard. Does that answer your question, Representative?
So I'm not quite sure when are these folks going to be heard on these three separated out bills?
When we are done voting on the bunch that we just talked about, if we can get to that point.
So we're going to be debating the bills before we even have had a public hearing on the bills. Is that the idea?
I hope that the comments are not so much debating as just expressing an opinion. Certainly we may have different viewpoints about whether or not bills have merit in a short session. Beyond that, I could not anticipate what the comments will be.
Thank you, Mr. Chair.
Thank you, Representative. Representative Pettit.
Unmute, sorry. I apologize, Mr. Chair, if we discussed this in screening. The first bill, which I think is an important issue, I know we're meeting with DPH later today. Is this something that could potentially go into the DPH bill, or does this need to be standalone for statutory reasons?
That's a good question. In that we've not had a chance to talk to DPH about their agenda to this point, we wanted to assure that this bill was in the mix. There may be other bills that we bring up subsequently for concept if we discover the DPH is not taking them up. I'm expecting that after our meeting with them today, that will add a number of concepts. As we know, this happens all the time. Sometimes one of the caucuses comes up with a bill that encompasses some of the things we're working on. Sometimes the administration comes up with a bill which covers things that we're working on. You will see a number of bills, and perhaps this is part of the reason why we have so many concepts that are intended at the very least to be placeholders to assure that one way or the other, these topics get a public hearing. Any other questions? If not, Madam Administrator, I believe we're ready for a vote.
I think it should be a voice vote, Mr. Chair.
Well, it's very interesting for you to interject your point of view on this. Would anybody object to a voice vote on these bills? Going once, going twice? Then we'll say all those in favor of moving to concepts, the bills that are aforementioned, please indicate by saying aye.
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 All those opposed indicate by saying nay. It appears that the ayes have it. Thank you, Madam Administrator, for easing this process, so we may move on to the three bills that may require a bit more conversation. We then move to item 3 under concepts to be raised, an act concerning aid in dying for terminally ill patients. This is a bill clearly that we have done before and last year actually passed out of committee. It is clear from polling of Connecticut citizenry that 2/3 or more of Connecticut citizens support such legislation. And given the positive progress and momentum this bill has had in the past year or two, it seems reasonable to assume this might have greater prospects this year. And that is why the chairs have decided to include this on the agenda. Are there other comments?
Mr. Chairman,
Representative Pettit.
my concern is just that it's the 5th or 6th year in a row that has come forward. And we can look at a variety of polls, but the groups representing the medical societies who are going to be at the forefront of this issue remain completely split on it, with some in favor, some opposed, and some unable or unwilling to take a position. So given the many other issues we face, and that this will likely be a all-day public hearing and as much or longer on the House floor, I don't know if it has priority, but that would be my personal opinion. Thank you, sir.
Thank you, Representative. It is true. The medical establishment is not unified on this subject, but they've also changed over the years, because at one point they were unified against it. Again, if you look at trend, not that that's necessarily the perfect indicator, it does appear that the medical establishment has a more open-minded approach than they've had in the past. Other comments? If not, Madam Administrator, I'm sorry, Representative Senator Haskell. We've already forgotten who you are. Okay, Senator Haskell.
No problem at all, Mr. Chair. I just wanted to thank you and others on the committee for prioritizing this bill. I think that although it has been debated for many years in the legislature, this can't come a moment too soon for those who are suffering from a terminal diagnosis or who have loved ones who are suffering. Obviously, this bill actually comes too late for many. So I really, in a short session, applaud the committee's leadership for taking up this challenging issue, and I want to thank you for it.
Thank you, Senator. Appreciate those sentiments. Senator Summers. Senator Summers, can you hear us? Are you still in your car?
Yes, good morning. My reservations on this bill, I echo what Representative Pettit had said, but in my conversations with many of the healthcare professionals that deal with end of life, they have said they would much prefer for us to have a conversation about palliative care here in the state of Connecticut and how it can be improved, rather than to move forward with the bill that they had reviewed, which they feel do not provide enough safeguards for those that are going home to end their own lives. So that's why I'm opposed to it being raised in this session.
Well, thank you for that statement, Senator Summers. I suppose it does depend upon who you talk with about what they would prefer, but we certainly welcome that those individuals testify before the committee when we have a public hearing.
And they will, definitely.
Anything else, Senator Summers? Okay. Are there any other comments before we take a vote? If not, sorry, Representative McCarty, just in time.
Thank you. I think I'm unmuted. Thank you, Mr. Chairman. I too feel compelled that I need to say something. And while I understand these are only concepts, I do echo some of the concerns that I've heard this morning, that we do have limited time. I did notice that you have scheduled a number of public hearings. I think we have debated this bill before, and it was my recollection that we still had quite significant work to do on it. So for those reasons, I will be a no today, but I understand that it's a concept. Thank you.
Thank you, Representative. Any other comments? Okay. Madam Administrator, we're ready for the vote.
Mr. Chair, I'd like a motion, please.
So move.
Oh, that's a good point. Boy, good thing you're around. Moved by Senator Anwar. Do we have a second?
Second.
Seconded by Representative Gilchrist. Now we seem to be ready for a vote, Madam Administrator, unless I'm missing something again.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Gilchrist, I did not see you on screen, please.
Representative Gilchrist votes yes.
Thank you.
Welcome.
Senator Wong,
Senator Huang votes yay.
Senator Wong, I did not see you on screen.
I'm in the car. Senator Huang votes yay.
Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Burgess Givallo,
Representative Berger Gervallo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Cabras DeGraw,
Everest DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Clarice Dietrich,
Representative Clarice Dietrich votes yes.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes no.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Tarziak, Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Madam Administrator, do we have a tally?
Total voting 33, those voting yea 22, nay 5, and 6 absent and not voting.
Thank you. We will keep the votes open to 9:55 because the Senate goes into session at 10. So others can still register their votes. Moving on to item 15, increasing access to reproductive health care. This bill intends to address potential changes at the federal level to reproductive rights and would seek to assure that women in the state of Connecticut have good access to abortion care should they so choose it. Beyond that, I won't comment other than to say that it would expand the type of practitioner who might participate in an abortion to include others beyond doctors. There may be other things in this as well. Are there any comments?
Mr. Chairman.
Representative Pettit.
Mr. Chairman, the comments made to me, people were concerned to realize that their concept that it was somewhat of a black box and incredibly vague, number one, and two, that extension of privileges may additionally involve changes in scope of practice for which we have received no input from the Department of Public Health. So there is concerns about the vagueness and whether it would be able to go forward without a scope evaluation. Thank you, sir.
Thank you, Representative. I concur that at this point it is a little bit vague, and it is our intention, particularly through the public hearing process, to make it explicitly clear. And to your point, we're always very sensitive in this committee to scope of practice issues, and we would want the agreement from DPH before we would proceed with this. And again, since we're meeting with DPH shortly, at least the chairs and the rankings, we will broach this subject with them. Are there others who choose to comment? Actually, why don't we see if we can get a motion to move this concept? Do I have a motion?
So moved.
Second.
Moved and seconded. Representative Gilchrist, Senator Anwar. Are there any other comments before we bring it to a vote? If not, Madam Administrator.
Representative Steinberg,
Representative Steinberg votes yes.
Representative D'Amico, hand is up. I don't know.
Did not see it previously. Representative D'Amico.
Mr. Chair, I apologize for being late. I didn't quite understand. What are we voting on? Because I heard something about removing. So I'm not sure what the vote is for.
Sorry, Representative, it wasn't clear. This is with regard to item number 15, and that's increasing, not removing, increasing access to reproductive health care.
I thought in your answer to Representative Pettit, you said something about removing this. So that's why I'm confused.
Sorry if I was not clear. I do not recall intending to remove anything, and that's certainly not the intention. If anything, it's our intent to make this concept very clear and explicit, and that that in the context of scope of practice, we will work collaboratively with the Department of Public Health to assure that we are in accord. Beyond that, I don't recall removing anything, but perhaps I did.
Oh, okay. No, perhaps I misheard. And so we are voting right now to raise this as a concept. That's what we're doing. And my second question, Mr. Chair, is it once a vote tally is announced, are we allowed to keep the votes open? I'm a little confused on that procedurally as well.
I did recommend we keep the votes open until the brink of the public session of the Senate, just in case a few others want to register, unless there's an objection to that.
No objection. I just didn't know if once the tally is announced, I didn't know if you were allowed to do that, but that's just my question.
Point. Thank you, Representative, for keeping me on the straight and narrow.
Okay.
The niceties. So we will not ask for a tally after this vote in order to keep it open.
Thank you,
Let's
sir.
start again from the beginning. Madam Administrator, let us have a vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative
sorry.
Gilchrist,
I don't think you saw, I'm not sure you saw me. I'm sorry. I didn't have my
Yes,
camera
sure.
on. Oh, okay, great.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Huang, yay.
Senator Summers, Representative Pettit,
Representative Pettit abstains. I'm not sure we have adequate information to make a decision on this.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django, Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Representative Gavras DeGraw,
Gavras DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Dietrich,
Representative Clarice Dietrich votes yes.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty abstains.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes. Thank you.
Representative Young.
Young votes yes.
I did not see you on screen, Representative Young.
You see me now?
Still not seeing you.
Try again. Any better?
Nope. Representative Zupkis, I'll come back to you.
Hi, and is this for, could you just tell me what we're voting on, please?
Item number 15.
15?
Increase
I'm a
the
no. Thank
It's a
you.
no? Thank
I'm
you.
a no.
Representative Young,
Representative Young votes yes.
thank you. Senator Summers,
Senator Summers votes yes.
Representative Betts, Representative Dauphiné, Representative Django,
Representative Jenga votes yes.
Representative McCarthy,
Representative McCarty abstains.
Senator Moore, Mr. Chair.
Thank you, Madam Administrator. Again, the votes will be open until 9:55 this morning. We now move to the last item in our concept agenda, item number 18, an act establishing the Office of Gun Violence Prevention and declaring gun violence a public health crisis.
So move.
Thank you, Senator Honour. Do we have a second?
Second,
Second.
Second by Senator Kushner and Representative Terziak, unless currently. This concept is one which acknowledges that since the landmark legislation this legislature passed after Sandy Hook, that our approach has been rather piecemeal. We've passed some very important legislation in past years related to sensible gun reform, ghost guns, bump stocks, storage, you name it, but that we have yet to make a serious effort to really stem the tide of guns in our state. And this is a bill which in many ways aligns with the governor's pronouncements on his desire to see us get much more serious about curtailing gun violence in the state of Connecticut. It establishes the Office of Gun Violence Prevention, in other words, somebody directly responsible for pursuing our efforts to reduce gun violence in the state and declaring gun violence a public health crisis. In many ways, this is one of the largest threats to our citizenry in many of our communities. And it's an indication of how seriously we take it and the need for us to both make concerted effort and devote resources in order to really reverse this trend of increasing gun violence. Are there any other comments with regard to this concept? If not, I'm sorry, Representative Cook.
Thanks, Mr. Chairman. I just have a really quick question. Are we going to be working with public safety on this topic, given the fact that I think that there is a crossover between us and public safety and gun violence? So if we're doing any public hearings, I would just request that we do that in conjunction with them in effort to save time and for folks to be able to, come to our public hearings and testify, but for us to be able to get, the most out of a public hearing. And so we don't have to continue to go back and forth from committee to committee. I support the concept. I'm just looking to throw that out there as a suggestion. Thank you.
Good idea. It seems as if collaboration would make perfect sense. We will take it into consideration and reach out to the chairs of the Public Safety Committee. Thank you for that. Are there any other comments?
Mr. Chairman.
Representative Pettit.
At the risk of being thick, which you can accuse me of, I'm not sure what this statement does. We're concerned about it, so why don't we work on the nuts and bolts issues as opposed to making a statement? I mean, we think smoking is bad, and we're working on specific legislation to do so. We think that littering the environment in certain ways is bad, and there's specific legislation. I don't really understand what impact this has on general society other than taking our time to make this the point you can make in a press conference or in communication with your constituents, et cetera, that you support legislation to improve the problem. So I'm just not sure that this gains us much. Thank you.
Hey, Representative, I'm glad you raised that because the title suggests that all we're doing is perhaps the symbolic gestures, and that is not really the case. If you follow the statements that have been made by the governor and his people, that there are specific and substantive steps that we would choose to take, including allocation of resources into the community for programs that have been shown to be effective and potentially could be scaled up statewide. We're expecting that in the public hearing, we will have a robust conversation about a variety of specific steps we might take to stem gun violence in our state. So the title might be a little misleading in the sense that it is our intention to be specific, to request resources and to do things that we expect to be able to really improve things. I hope that answers your question. Next is Senator Summers.
Yes, I just wanted to share that I did speak with the ranking member of Public Safety, and they would very much like to have this be a joint hearing with Public Health as we move forward.
Thank you for that, Senator. I'm glad you've already initiated.
Hey, Dan? Dan.
I'm sorry, Senator Wong, could you make sure you're muted, please? Senator
Talk to
Kushner.
Heather. Yeah, I just did. Okay. It should be a joint. He just announced it.
Thank you. I'm not sure if Senator Huang wanted to speak because he's unmuted.
Well, he's muted again, so if he does, he can raise his hand.
Okay, great.
Senator Kushner.
Thank you. Thank you. I just wanted to speak to and support of this. I do think that we often have very narrow views about what is public health and what is a public health crisis. And so I think the title reflects that we are, as we did last year when we voted to say that racism is a public health crisis, I think this is similarly positioned to really garner the support and the attention that we need to pay to this, because people often don't connect the dots and see this in the way that we are projecting, that this is not just a crisis, but it's also a crisis for public health. So I think I appreciate the title and support it.
Thank you, Senator. Other comments or questions? Okay, seeing none, Madam Administrator, I believe we're ready for the vote.
The clerk will be taking the vote, Mr. Chair. I have to start the next meeting, so I have to jump off.
All right, so who's going to do that?
Dallas.
Hello,
All
Representative.
right,
Your vote?
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Huang, Senator Huang,
Senator Huang votes yes.
Senator Summers,
Senator Summers votes yes.
could you go one more time, Senator Summers? I couldn't see you.
Can you see me now?
Yep.
Senator Summers votes yes.
Thank you. Representative Pettit? Abstain. I didn't hear any information to make a vote on. Thank you. Representative Arnone?
Representative Arnone votes yes.
Representative Berger Javallo?
Representative Berger Javallo votes yes.
Representative Betts? Representative Carpino?
Representative Carpino votes yes.
Representative Cook?
Representative Cook votes yes.
Representative Dauphiné? Representative D'Amico?
Representative D'Amico votes yes.
Representative Elliott?
Elliott votes yes.
Representative Foster?
Hey. All set, I know. Now you can enjoy your breakfast. Sorry.
Rep Foster votes yes.
Representative Jenga?
Representative Jenga votes yes.
Representative Green?
Representative Green votes no.
Senator Haskell?
Senator Haskell votes yes.
Representative Cabros DeGraw?
Cabros DeGraw votes yes.
Representative Kennedy?
Kennedy votes no.
Representative Clary Citria?
Representative Claire DeStitria votes no.
Representative Linehan?
Representative Linehan votes yes.
Representative McCarty?
Representative McCarty votes yes.
Senator Moore? Representative Parker?
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
could you go one more time, Representative Zupkis? I couldn't see you there.
Representative Zupkis votes no.
Thank you.
Thank you. We will keep the votes open for roughly another 7 minutes. That concludes raising the concepts for today. I will note for the committee and for the public that our next meeting is this Friday, the 18th at 9 a.m., which will be via Zoom and YouTube Live. Thank you for your cooperation today. We're off to a good start, and we will talk to you before the week is out. If there are no other business, we will stand temporarily adjourned. Representative D'Amico, are you raising your hand?
Sorry, Mr. Chairman, it's Representative McCarty. I have my hand raised. Yes, may I just ask for a point of clarification? I believe on one of my votes, I had an abstention that I would like to change. Can I stay on and speak with the clerk?
Absolutely.
Thank you.
Clock is ticking though. We're down to like 5.5 minutes.
Thank you.
Anyone else?
Mr. Chairman,
Yes, Representative Carpino.
I just want to be clear, we're not adjourning. We're actually recessing to allow those who might need to vote yes.
Yeah, I'm really out of shape here, Representative Carpino. I've really got to get my language precise. Thankfully, it's the very beginning of the session. We'll get it all straightened out. Thank you for the clarification.
We're going to keep you on the straight and narrow, Mr. Chair. Don't worry.
Expect no less from you, Representative D'Amico. If not, just what she said. Thank you all. We'll see you soon.
Thank you. Dallas, are we ready for votes for people who were late?
Certainly.
Great. Do you want to read them individually, or can I tell you that, yes, I've seen the list and I'm in favor of everything?
Okay.
Oh, go. That'll do.
Perfect. I've got the other sheet. I'll go ahead and make a note.
Dallas, thank you. Dallas, if I may ask, I abstained. I had 2 abstentions. The second abstention, can you look at that? Because it came quickly and I wanted to be sure that I was voting on the appropriate piece in front of me, which rarely happens, but I was distracted. So if you could just tell me that.
Your second abstention was on, item number 15, which is increasing access to reproductive health care.
Okay, and then was there another one beside that? Because that was okay. I just thought I might have abstained on the
I don't believe so.
the revisions. You have a yes for the revisions vote then?
I do, on item number 18.
So I missed nothing. Okay, then I'm all right. I did better than I thought. Thank you. Stop laughing, Representative. Thanks a lot.
Dallas,
Hello, Representative Jenga.
there was a little confusion on one of my votes. I wanted to see if all my votes were recorded.
One moment. We've got 3 yeses from you, Representative Jenga.
I'm sorry?
We've got 3 yeses from you on all 3 items.
Right, then I wasn't sure that the second time I voted because the first time I wasn't heard.
Gotcha. Yep, all 3 went through. You're all set.
Thank you. Happy Valentine's Day.
You too.
Good for you, Henry. Happy Valentine's Day.
Same to you, Mr. Tersiak.